So your recovery process after breast augmentation surgery can be divided into different stages or phases. And what I'd like to start with is the very beginning stages where you might have a feeling of pressure, tightness, and you might experience some discomfort. And that's where you may need some supplemental medications that we prescribe for you. They include things like a muscle relaxer, can be a gentle narcotic. We also inject numbing medication during the procedure that can last for a few days. So that also helps to decrease the overall discomfort factor. But we also give you anti-inflammatory medications, nerve desensitizers. You can supplement things like adding Tylenol to the regimen as well. And overall, your discomfort phase for most women can last from a day to a few days and upwards of a week for some. Usually you need to be off of those medications, especially the ones like your narcotic or muscle relaxer, before you consider driving so that your senses are not affected. The next stage of recovery is really about your activity restrictions. So what can or can I not do during that period of time while I'm recovering? Initially, you're going to be very tight and sore here. So just lifting your arms is going to put a lot of stress and strain on the breast pocket. So I generally recommend that you keep your elbows to your side. If you're going to wash your face, you can do that. If you're going to wash your hair, you might tilt down while you're washing. And after about a week, when some of the swelling goes down, you're going to start to develop more mobility. Even in the kitchen, you may want to put your favorite things that are on the high counters, bring them down, or high cupboards, bring them down to more counter level, so you're not having to reach initially. Once you get to the 2-week mark, you should have a lot more range of motion and movement. Now, in terms of exercise, now this is a big challenge because we definitely have a group of women or patients that come in and saying it's really hard to stop my exercise regimen. You do need to take it easy as far as strenuous exercise, sexual activity, lifting for about 6 weeks to allow that scar tissue to heal enough that it can tolerate that degree of activity. If you were to do just general walking, you can start that in day 0 or the same day as your surgery, and you can do that progressively throughout that 6-week period as well. Once the 6-week milestone comes in, I generally tell patients to listen to their breast, listen to their body when they're resuming more strenuous activity. If it hurts to do something, dial it down. If you feel like you overdid something and it's a little uncomfortable, wait a day or 2 or 3 for things to calm down, and then you can resume it at a lower level of intensity. It may take anywhere from 2 to 4 weeks for you to get back to where you were at 100% level prior to your surgery. After breast augmentation surgery, your breasts are going to be in a more upward position, and it may take upwards of 3-6 months for them to really settle down to their position. Your breast tissue is also forming scar tissue in that first 6 weeks, but it's going to remodel and change and evolve over the course of the next 6 months as well. So a really good indicator of what your breasts are going to look like for the long term is around that 6-month mark. You'll get a progressive look between this time of surgery towards that 6 months, but it is a gradual, subtle change that happens over that period of time. After your breast augmentation surgery, we typically like to see you the very next day just to make sure everything looks appropriate and that we can help answer any additional questions that might be more at the peak of interest in terms of what can I not do. We're going to review some of your do's and don'ts after the surgery, and to help if there's any disproportionate discomfort, we can troubleshoot and see what we can do to help manage that as well. The first dressing change we're doing as well, so that's where you get a little more of that reveal experience as well. And that's where we'll tell you it's okay to shower when you go home after your first appointment. After that, we'll see you at a week's time, 2 weeks' time, 6 weeks' time, 3 months, 6 months. These are just some different intervals. And then at a year's time as well, so we can just see how your breasts have settled and how they've evolved over that period of time. If you do experience something that's unexpected, you definitely want to keep in touch with the practice. You may want to come in for a visit, even if it's not part of your routine scheduled visit. And we can then talk about some other things, assess you, and then come up with a plan to help resolve anything that might arise. So common question I get is, how often do I need to change out my implants, or how long will my results last? In general, I would say that if you are happy with the shape and size and feel of your breast, then, and if it's been 5 years or 10 years or 20 years, you don't necessarily need to change anything. If, however, aging, pregnancy, breastfeeding, weight changes, all of these things can influence the shape of the breast, and it's evolving to a point where you're saying, I wish I could make them perkier or lift them up, that might be the reason to consider changing out the implants. If it's been probably more than 5 to 10 years, then we might consider changing the implants at the time of another breast procedure. Now, if you said what influences how much the breast may change its shape over time, I would say it's the skin and tissue envelope. If you have a really rich, firm, fibrous skin and tissue envelope, then that's going to help maintain the shape. If you have a lot of stretch marks, or you're thin as skin, or you have a lot of sun damage in there, then you may find that the weight of the implant is starting to stretch that breast tissue over time. When you have an implant and you're placing it on the breast, that breast has to hold that implant in place. Now, sometimes the larger the implant, the more work that breast tissue has to do. So if the breast tissue is already partially compromised by stretch marks or aging or sun damage, then we may be wanting to offload some of the work that the breast has to do to hold the implant. That's where a notion of an internal bra, and here's an example of one, can be done, where we're putting it on the inside and it's supporting the implant so the breast itself doesn't have to do all the work to maintain its shape. It's providing some internal support. People that are, or patients that are getting larger implants may opt for this, or patients that have more compromised breast tissue may also consider this as well. So these are ways or strategies to help support the implant on the inside to help increase the longevity and slow down the effects of the breast tissue thinning or stretching. So let's say you have breast implants, you love the shape, you love the size, everything is going well, but you say, what can I do to preserve the look of my breast for an extended period of time and reduce the chances that I might need to do something because the skin envelope or the tissue envelope starts to sag or droop over time with aging, weight changes, pregnancy, breastfeeding, etc. So just like our face ages, our neck ages, our bodies are aging, including our breast, and we're going to be losing collagen and elastin every year that passes by. So we have a number of women who are treating their breasts like they do with their face. They're doing things like microneedling, they're doing things like peels, they're using energy-based devices to stimulate collagen and elastin. They're definitely protecting with sunscreen anytime it might be exposed to get environmental exposure. So these are all things that can be done on a routinized maintenance basis after your surgery if your goal is to try to preserve the look and feel for as long as you can. Thank you for joining me today, where I was able to answer many of your breast augmentation questions. If there are questions that you have that I was not able to cover, please leave them in the comments below so we can address them in future presentations. If you enjoyed this video, please give us a thumbs up by liking the video. Remember to subscribe and hit the bell icon so we can keep you up to date on future topics. Thank you so much for joining me today. I look forward to seeing you the next time.